If my arm suddenly went numb, if my speech began to slur, if half of my face felt heavy and lifeless, I would only have minutes to save the rest of my life. And I'm not speaking as a patient, I'm speaking as a doctor, a stroke doctor. And if I ever had a stroke, here's exactly what I'd do. It might start as something subtle. Maybe I'm sipping my morning coffee, reading a message when I realize I can't quite hold the cup right. My hand feels strange, weak, almost disconnected from me, as if it belongs to someone else. Or maybe I speak, just a simple sentence, and I hear it come out all wrong, garbled, slurred, like I'm drunk, but I'm not. I know something's wrong. I've seen this hundreds of times in my patients, but now it's me. At that moment, my brain would be screaming one message. Time is brain. Every second I delay, 1.9 million neurons die. That's 14 billion synapses lost, and it's not just numbers. These are brain cells that control how I move, how I speak, how I think, how I remember who I am. If I wait and hope it passes, I may never speak again. I may never walk again. I may never return to work. I may never play with my kids, so I wouldn't wait, not even for a minute. And no, I wouldn't take an aspirin, not at the start, because if this is a bleed, not a clot, that tablet could make things catastrophically worse. And the truth is, in that moment, without a scan, I can't tell the difference. No one can. It's one of the biggest mistakes I see people make. They self-medicate, thinking they're helping, when they might actually be making things worse. The very first thing I would do is call emergency services, immediately, not after making a cup of tea, not after seeing if it wears off. I wouldn't try to drive myself, not only because it's unsafe, but because I could deteriorate at any moment. I wouldn't waste time looking things up online. I wouldn't call a friend for advice. I would pick up the phone and call for help, because every second matters. Then I would unlock the front door. It might sound like a small thing, but it could save vital minutes. If I collapse before help arrives and I can't get to the door, those extra moments waiting for someone to break in could cost me everything. After that, I'd sit or lie down somewhere safe, somewhere low to the ground, away from stairs or sharp furniture. Stroke can affect your balance, your vision, your ability to protect yourself in a fall. And if I go unconscious, I don't want to be somewhere I could cause further harm. I know the clock is already ticking. If this is a clot blocking a major artery in my brain, and it often is, I've got a narrow window to reverse it. Roughly 4.5 hours for thrombolysis, a clot-busting drug that dissolves the blockage. Up to 6 hours, sometimes longer, for mechanical thrombectomy, where a specialist threads a device into the artery and physically removes the clot, but in both cases, the sooner the better. The quicker blood flow returns to my brain, the more brain tissue I save. Every minute without oxygen leads to permanent injury. When the ambulance arrives, the paramedics already know it might be a stroke, because I told the call handler about my symptoms. They'll waste no time. They'll check my blood pressure, oxygen levels, heart rate. They'll do a finger prick blood sugar test, because very low blood sugar can mimic a stroke. They'll assess my level of consciousness and ask me to smile, raise my arms, repeat a sentence, part of a stroke scale like FAST. Most importantly, they'll pre-alert the nearest stroke team. They'll say something like, middle-aged man, suspected left hemispheric stroke, right arm weakness, slurred speech, onset 20 minutes ago, GCS 15, ETA 8 minutes. And just like that, a chain reaction begins at the hospital. A scanner is cleared, the stroke team is paged, the resuscitation room is prepped. Every step saves time, and time saves brain. By the time I arrive, the stroke team will be waiting. And here's where it gets emotional for me, because the people waiting for me, they might be my colleagues, my friends, the same doctors and nurses I've worked with for years. But today, I'm not their peer, I'm their patient. It's an incredibly vulnerable place to be, but I trust them, I trust the system, because I know they've trained for this, day after day, drill after drill. I'll be rushed straight to the CT scanner. No delays. In the best stroke units, this happens within 10 to 15 minutes of arrival. Guidelines aim for scanning within 60 minutes, but in reality, speed is everything. I'll lie on the scanner bed as the machine rotates around my head, taking images of my brain. At the same time, a nurse will be drawing bloods, full blood count, clotting profile, glucose, kidney function. Another team member will be trying to confirm exactly when my symptoms began, either from me, if I can speak, or from someone I was with, because that moment, the onset time, determines everything. Whether I'm eligible for life-saving treatment or not. If the CT scan shows no bleeding, just a blockage, and if I meet all the other criteria, I may be offered thrombolysis, an injection of alteplase, or another clot-busting agent. The doctor will explain the risks, bleeding, including a small chance of bleeding into the brain. But they'll also explain the potential to reverse the stroke, to walk again, to speak again, to get my life back. It's not an easy decision, but I've given that treatment myself many times. And in the right person, at the right time, it changes lives. If the blockage is large and visible on a CT angiogram, I may also be offered mechanical thrombectomy, a procedure where an interventional radiologist uses a catheter to physically remove the clot. It's one of the most effective treatments in modern stroke medicine, and it saved patients I thought had no hope. After treatment, I'd be transferred to the hyperacute stroke unit, a specialized ward where patients are monitored intensively in the first 72 hours. I'd be on a monitor, checked frequently for any change in symptoms, assessed by a swallowing team to reduce the risk of choking or aspiration pneumonia, started on blood-thinning medication if appropriate, and most importantly, I'd begin rehabilitation, often within 24 hours. Then I'd move to the main stroke ward, where recovery truly begins. I'd meet physiotherapists who help me regain strength, occupational therapists who retrain me to manage daily tasks, speech and language therapists to help with communication and swallowing, clinical psychologists to support my mental health. It's hard work. Some days I'd feel hopeful, other days angry, frustrated, exhausted, but I'd hold on to the knowledge that recovery is possible. I've seen it, I've helped guide it, and I know deep down that if I'd delayed getting help, the outcome could be completely different. I might not be able to return to work. I might never be able to explain to my children why my speech changed. I might become a stranger to myself, because stroke doesn't just rob you of movement, it can rob you of personality, of language, of memory, of joy, but early action gives me the best chance. Once I'm discharged, my journey continues. I'd attend outpatient rehab, take my medications religiously, I'd track my blood pressure, wear a heart monitor if needed to check for atrial fibrillation, I'd walk daily, eat better, sleep more, I'd cut out things that raise my risk, smoking, excessive alcohol, sedentary life, because once you've had a stroke, you're at much higher risk of having another. But it's not inevitable. Stroke prevention works, if you do it right, and I'd tell my story, not for sympathy, but because someone needs to hear it. Someone needs to know that calling for help straight away can be the difference between walking and never walking again, between a normal life and a life changed forever. I've seen patients who arrived unable to speak, giving wedding toasts a year later, patients who were paralyzed, walking their daughter down the aisle, patients who thought it was over, living fuller lives than they ever expected. So if I ever had a stroke, I'd be scared. Of course I would. But I'd be ready, because I know the signs, I know what to do, and I know what's at stake. Please, know the signs too. Face, arm, speech, time. Call emergency services. Don't wait, don't guess, don't Google, because the person you save might be yourself, and stroke doesn't always have to be the end. With the right action, it can be a new beginning.